After several years serving in the United States Armed Forces, Tom is facing significant health challenges.
My vision's getting really bad. My brain's not working like it used to.
Tom isn't able to travel to important medical appointments, but when his doctor at the VA wanted to transfer him to a medical facility in South St. Louis,
I just said, no, send me home.
and so health care comes to Tom, not from a doctor or nurse practitioner, but through nurses from the local public health department. Shannon County Health Center operates home health and in-home programs that provide wound care, physical therapy, personal care, cooking, and other services.
Listen to your heart and lungs, okay?
Home health and in-home programs are not considered to be foundational public health services necessary in every jurisdiction in Missouri. But public health agencies are charged with filling gaps and assuring services to meet unique needs in their local communities. For rural Shannon County, poverty, lack of transportation, and limited access to care are major equity gaps that are currently being addressed by the local public health agency.
Every patient deserves health care, and they deserve the best health care that they can get in their area. And so in our area, with it being so rural, where it's hard for them to travel to their physician's office and to outpatient facilities, home health is a key factor.
Richard and Enora live in southwest Shannon County. Between them, they have a long list of health issues, including bone spurs, depression, and heart disease.
But when I had my knee operated on is when we got involved with Shannon County Health Department. And they were fantastic. I mean, they were concerned. When my legs started turning red, they were out here, Johnny on the spot.
Public health nurses also visit Richard and Enora regularly to check dressings, monitor medications, and provide health care services they can't travel to access.
They are just fantastic, you know. They come in and do the check our hearts and everything, and our blood pressures, listen to us breathe, and the whole 9 yards.
Kendra Counts is the administrator of the Shannon County Health Center. She says while home health and in-home services are meeting important needs in this rural community, they're just two of the many services the health center offers. Public health is responsible for creating a healthy environment for everyone in the community.
We touch every spectrum of people's lives here at the health department, from babies to teenagers to, pregnant women to the elderly.
A spectrum reflected in the 13 foundational public health capabilities and areas of expertise identified in Missouri's Foundational Public Health Services model. These capabilities and areas of expertise must be available in every community in order for Missouri's public health system to function. Count says the FPHS model visually describes the work public health agencies do every day.
The model touches every aspect of those people's lives. So when you're looking at one section, maternal and child health, you're looking at, our pregnant women, and then you've got your chronic diseases, so you're talking about your elderly, immunizations. We just do so much here at the health department that the model really fits perfectly with everything that we do.
Like Shannon County Health Center, every public health agency in Missouri is tasked with assuring health equity for all Missourians by addressing social determinants of health, like transportation, poverty, and access to health care. The inner ring on the model emphasizes that equity should be a lens through which all public health services are assured. J.C. Kusner is a former member of the Missouri House of Representatives and lives in Shannon County. He says he's seen the results of health inequities in his community personally. He's watched friends die because they didn't get preventative care. They couldn't afford it.
It's awful easy to think that, that health problem is connected to they smoked. That health problem is connected to their diet. That health problem is connected to their living conditions. And those are all relevant, and there are some truth in that. But not everybody is in those conditions because they want to be. They're not in those conditions because they made a choice.
He says the needs of rural communities are often overlooked and that more funding is needed for public health agencies in rural areas of Missouri.
I think that if we had in facilities like we're in here today, Shannon County Health Center, if we put the money in here, a portion of the money in here, then we would have an opportunity to do more preventative medicine and more in-home visits and actually see one-on-one.
He says many rural Missourians work hard, but just don't have access to health insurance, and they're embarrassed and don't want to be a burden on the system, so they put off medical care.
These folks are putting everything on the line. They're putting their lives on the line just because they don't believe that they deserve that health care. And what a travesty to think that people who all their life have worked hard, played by the rules, lived the American dream, sent kids off to the military, don't believe that they deserve good health care. There's something wrong with the system that's beat them down to that point.
Across Missouri and here in Shannon County, local public health agencies are stepping in to address these types of health equity barriers and fill gaps to assure foundational public health services for everyone. Richard and Enora are grateful for the care they receive from the Shannon County Health Center nurses.
I can't say enough about how good we have been treated and are being treated.
And Tom goes even further in his praise.
They're my guardian angels.
Missouri residents like Tom, Richard, and Enora deserve the opportunity to live their healthiest lives. With additional support and vital resources, public health agencies will be better equipped to continue working every day to address barriers and assure foundational public health services for all Missourians.